request has been for today's medical moment that we talk about maggots. Woo-hoo! So the term maggot refers to fly larvae. In California, in North America, the flies that we find will lay their eggs on dead and dying tissue, which then turn into larvae. In North America, there are no flies whose larvae invade living flesh. That's not true worldwide. In Africa, there are flies that will attack living flesh, but here in the States, we don't have those kind. So if there is a wound on a pet, which is severe enough that tissue has lost its blood supply, and the tissue is now dying, dead or dying, and if that pet is outdoors or exposed to flies, there's a chance that flies will find that unhealthy tissue, lay their eggs, eggs grow into larvae, which we call maggots. So clearly, if we find fly larvae, we know that there's unhealthy tissue involved. In theory, if there was feces caught in a hair coat, caught in fur, that could be the source for the place that the flies are laying their eggs. So it's not always a wound, but sometimes it certainly can be unhealthy tissue where the larvae have found their way in. Interestingly, there are times when using larvae, because what the larvae do is they eat the dead and dying tissue. There are times in human medicine when larvae are used purposefully to eat away unhealthy tissue, because the larvae that are chosen for this are the ones that stop when they get to healthy tissue. And clearly you wouldn't use an African fly. So that's the maggot story.